So welcome to this video on ABG Interpretation. Here we're going to have a look at the normal values and then we're going to have a look at a couple of abnormal values from a respiratory perspective. So one thing I want you to remember at undergraduate level in nursing, obviously depending on your unit coordinator, you should really only need to know the basics when it comes to interpreting ECGs. It is a specialised area, and if you do end up working in the emergency department or intensive care, critical care areas, then you will learn about them in more detail once you've qualified. So don't stress about them too much. So when it comes to ABG interpretation, these questions often pop up on exams. I've sat a lot of exams in my time, and you really need to know the basic what's normal before we can have a look at what's abnormal. So what is an ABG, what we're doing, what we're measuring? You need to know what we're doing if you want to understand them. So pH stands for per hydrogen. We are basically measuring the amount of hydrogen ions in the arterial blood. Okay, so the normal range for pH is 7.35 to 7.45 here. Okay, now as long as our body maintains a pH within that level, we are maintaining homeostasis and our body can function in a normal manner. Okay, now another thing to look at here in the ABGs is your PO2. So this is measuring the arterial pressure of oxygen. We tend not to look at this so much for metabolic respiratory acidosis, alkalosis. We are focusing on the PCO2 and the bicarb, which is HCO3. So I've listed this here just so you get used to seeing PO2, but we won't talk too much about that when it comes to interpreting ABGs. Okay, so the PCO2. Okay, this is very important. What this is doing, this is giving us our normal measurement, 35 to 45. If there's a problem with the PCO2, your patient generally has a problem with the respiratory function. Okay, and bicarb, HCO3 is bicarb, and the normal figures for this are 22 to 26 millimoles a litre. If there's a problem with bicarb, it means there's a metabolic problem, whether it's metabolic acidosis or alkalosis. Okay, so these are the normal values. If you're having trouble remembering these, just have a look at the pH, that's 7.35 to 7.45, and then if you remove the 7, that's giving you what your PCO2 is, 35 to 45. Okay, then you just need to remember your PO2 and your bicarb levels. Now, I just wanted to let you know that in different textbooks you will see different values, so please refer to your unit text for the correct values. Okay, now moving on, I'll just give you some figures here. This is what a respiratory acidosis would look like. Okay, so the pH here, we can see that it's 7.30. So it's outside of this normal range. Now 7.30 is below 7.35. So that means we've got an acidosis. Okay, so we can tell just by looking at the pH that we're dealing with an acidosis. Remember how I said ignore the PO2? We're just going to ignore that. Then we're going to go and have a look at the PCO2. That's 60. If we go back to our normal values here, that's way above what it should be. Okay. Now we know that carbon dioxide, it's an acid. So the more of that in our body, the higher this number, that's going to give us an acidosis. So I can tell looking at this already that we've got a respiratory acidosis. Now we'll have a look at the bicarb. That's within normal limits. We've got our diagnosis right there. Now moving on to respiratory alkalosis. First of all, let's take a look at the pH. That's 7.51. So that is above the normal range at the high end of 7.45. So we know immediately that we are dealing with an alkalosis. Again, we're going to ignore the PO2. We're going to have a look at our PCO2 again. Now this is low. It's 20. Way below the normal range of 35 to 45. Now what's happening here is, for some reason, our body is blowing off CO2. So I guarantee this patient will have a high respiratory rate. They will be blowing off all their carbon dioxide. And that's why we've got a respiratory alkalosis. Again, we'll look at our bicarb. That's normal, not a problem. So common causes for respiratory acidosis, we can have pneumonias, respiratory failures, exacerbation COPD. With respiratory alkalosis, if you think of why people have a high respiratory rate, one common condition is anxiety. They'll be blowing off the CO2 because the respiratory rate is high, and then that will result in a respiratory alkalosis. I'll be back with more videos. Thank you.